Hello students, so today we are going to discuss about oncological treatment. That is, oncology stands for cancer. So today we are going to discuss about treatment of cancer. So today's topic is caring for clients undergoing oncological treatment. Now, why is caring for clients undergoing oncological treatment important for nurses? That's because most of the cancer patients will be treated with chemotherapy. So what is chemotherapy? Chemotherapy is to administer anti-cancer drugs to the patient. So these anti-cancer drugs are a group of cytotoxic drugs. So cyto is the cell, toxic is toxic to the cell. So during chemotherapy, what is done is you administer drugs which are toxic to the cancer cells. So once these drugs are administered, these anti-cancer drugs will kill the cancer cells. So that is what we call cancer chemotherapy. So most of the cancer patients are treated with these chemotherapeutics, that is anti-cancer cytotoxic drugs. So who handles these drugs? The doctor will be prescribing the drugs. Then there are certain professionals which will be mixing the drugs for you all, preparing, calculating the dosage of the drugs, and then you will have to mix the drugs and administer the drugs to the patients. Now remember, most of these cancer chemotherapeutic drugs are potentially very hazardous. So that is, they have a lot of adverse effects or side effects, not only to the patient but also to the person who mixes the drugs and who administers the drugs to the patient. So since you as nurses will be mixing the drugs and administering the drugs to the patient, having a proper knowledge about these cancer chemotherapeutics and their hazards is important for you to protect yourself as well as the patients from these potential hazards of cancer chemotherapeutics. So that is why having a knowledge about cancer chemotherapy is important for the nurses in order to take necessary precautions to overcome these potential hazards. Right, so now we'll have a look at the nurse's role in treating oncology clients, patients having cancer. Okay, so the nursing characteristics of a nurse who treats the cancer patients should include the following. So first of all, they need to have a proper knowledge about the types of cancer, their signs and symptoms, in order to get an idea as to which type of cancer the patient is suffering from. Next, you should now medicine is always updated, right? So the nurses should also update their knowledge about the cancers, their signs and symptoms, how the diagnostic procedures and the treatment, in order to provide a better service to the patients. You have to, now when a patient comes to you for oncological treatment, maybe they suffer from other medical or surgical illnesses as well. So as a nurse, it's your duty to monitor their current medications, the drugs which they are already taking for some other illnesses, their lifestyle, their culture, their individual preferences on how their treatment plan has to be planned out. So all these things have to be considered. And also you should keep in mind about the potential toxicities of these drugs and the patient's goals and priorities when it comes to uh, planning out the treatment plan for the cancer patients. Next, you should now cancer patients are usually treated in specific institutions or special hospitals. So, they may have to travel a long way from home in order to receive these treatments. So, as nurses, it is also important for you to consider their financial status, their travel problems, how they travel, whether they have any problems with traveling, whether they have a proper place to stay during the treatment course, and all the psychosocial factors that may affect the patient's treatment. So you should consider all these when you're planning out the treatment of the patient. Cultural influences, client support systems, what sort of support he's getting from his family and friends, as well as from the workplace, the place where he's occupied in. So all these have to be considered. And yes, so when you're planning out the treatment, all these have to be considered. And at the same time, once the patient is on treatment, you have to monitor the patient closely for his condition and any symptoms of side effects, because then the treatment will have to be altered or adjusted accordingly in a way that the patient suffers least from these side effects. Okay, so the nurse's role includes to help the patient and the family to make treatment decisions, to maximize the patient outcome by improving uh, the patient's symptoms by proper treatment, and by helping the patient to regain his functional ability as soon as possible, as well as by ensuring the patient safety, and while taking into consideration the patient's psychological distress, costs, then travel constraints, all these while planning out the treatment. So a nurse's role here during oncological treatment is to provide a good service to the patient in order to support the patient regain the highest quality of life possible within a minimum period of time. So a nursing care plan, to do all these things, a nursing care plan has to be developed. So this nursing care plan needs to focus on promoting the client's understanding about the disease, about the treatment options, how his treatment is scheduled, and about the potential side effects of the therapy. At the same time, your treatment, the nursing care plan should include preparing the patient and the family psychologically for the treatment. Not only that, the patient needs to be prepared physically to undergo the treatment process as well. So during the treatment and after the treatment, the patient has to be monitored closely for any symptoms of side effects, as well as for any psychological or physical discomfort. You should be vigilant about oncological emergencies, right? And you should also be alert on the patient's compliance to treatment, and most of the patients, especially the patients undergoing surgery, will need rehabilitation in order to ensure a better quality of life after the treatment process. And for patients suffering from terminal disease, palliative care will be much needed. So, preparation of an oncological client before the treatment includes two things. One thing is psychological preparation. So, psychological preparation includes psychological preparation of the patient as well as the family for the procedure. The second thing is physical preparation, preparation of the patient to undergo the treatment procedure. So during the treatment, you have to anticipate the common side effects of the treatment procedure. You have to closely monitor the patient for these side effects, and you have to also assess the patient's response to the treatment procedure. You have to be vigilant about oncological emergencies, where you have to take prompt action in order to prevent fatal complications, because these can be life-threatening to the patient. When a patient is on oncological treatment, it is not only the drugs. So, both the pharmacological treatment as well as non-pharmacological measures should be combined in order to maximize the outcome and to minimize the side effects. And while the patient is on treatment, you have to take all necessary measures to prevent the toxic complications of the drugs. And at the same time, you have to, now there are some side effects which are inevitable, which will happen with the cancer treatment. So as nurses, it's your role to provide the support to the patient as well as to the family to deal with these inevitable side effects of oncological treatment. Now here are some cancer related symptoms, cancer treatment related symptoms which are inevitable, which will be seen in most of the cancer patients. So as nurses, it is your duty to provide proper support to the patients and their families to deal with these cancer treatment related symptoms. So what are these symptoms? One is anorexia, loss of appetite, cognitive dysfunction. Following the treatment, these patients will have problems with, they'll be confused, there will be difficulties in concentration, there will be memory problems. So all these cognitive dysfunctions, depression, dyspnea, shortness of breath, fatigue, they will easily feel tired. Some, depending on the type of treatment, they will have hormonal imbalances, sometimes hormonal disturbances, neutropenia, that is low white blood cell neutrophil count. So neutrophils are protective against bacterial infections. So when the WBC count, especially the neutrophil count, reduces, it predisposes to infections. So following cancer treatment, the patients become more prone to suffer from infections, pain, peripheral neuropathy, damage to nerves, and sexual dysfunction. So these are some of the cancer treatment related symptoms. So as nurses, it is your role to help the patients deal with these cancer treatment related symptoms. Now after the treatment, you have to explain to the patient the sequence of the treatment plan. Now the patient might think the treatment ends with one cycle, but sometimes it may not be so. So you have to explain in detail about the sequence of the oncological treatment plan. Next, you should assess the client's condition and his response to treatment. You have to pay attention to the client's choice in other treatment options. You have to give the patients proper follow-up care, and most of the cases you will have to refer the patients for rehabilitation in order to help the patients regain their normal day-to-day functions and to improve their body image following treatment. And you have to prepare the patient for the next treatment as soon as possible. Sometimes you may have to maintain palliative care, and at the same time you will have to monitor the patients closely for oncological emergencies which may be life-threatening. Right. So that was a general guideline on how a nurse should act when dealing with patients undergoing oncological treatment. Now there are 4 main established oncological treatments. So one is surgery. That is, by doing an operation, you try to remove the cancer cells from the patient's body. Second is radiation therapy. That is, you aim ionizing radiation. These rays will go and destroy the cancer cells. So that is called radiation therapy or radiotherapy. So it could be external beam radiotherapy or internal radiotherapy. Next is biologic therapy. So biologic therapy is to give certain biological substances that will help to destroy the cancer cells and boost the patient's immunity. Next is chemotherapy. So chemotherapy is to administer anti-cancer cytotoxic drugs which will go and kill the cancer cells. So these are the 4 main established treatments for patients suffering from cancer. So now we'll first see care for patients undergoing surgical therapy. So preoperatively, now this care for patients undergoing oncological surgery requires preparation of the patients and the family before the surgery, during the surgery, and after the surgery. So first we'll see how the patients and the family has to be prepared before the surgery, that is preoperatively. So this includes psychological preparation of the patient as well as the family regarding the treatment which the patient is to undergo, and the physical preparation of the patient to undergo the surgical procedure. So psychological preparation includes you have to explain to the patient and to the family about the treatment procedure and its outcome, right? And you should never give false assurances, but you have to assure the patient that in most cases it had been successful, so there is a higher success rate. Physical preparation is how you prepare the patient for the surgery. So depending on the type of surgery, this preparation will vary. For example, now like any other surgery, you may have to prepare the bowel, then sometimes then you will have to perform all these pre-anesthetic investigations in this patient. Sometimes you may have to administer pre-medications, anesthetic pre-medications, and before the surgery you will have to prepare the skin, right? So skin preparation. So all these things include the physical preparation of the patient to undergo the surgery. So post-operatively, care is provided in 2 settings. One is immediate care, that is after the surgery. For the immediate period following the surgery, you have to closely monitor the patient for any immediate effects. And once the patient becomes stable, the care provided to the patient is called subsequent care. And most of the time after the surgery, the patients may need rehabilitation to regain their normal functions as early as possible, right? Okay, so that was about the caring for the patients undergoing surgery as oncological treatment. So now we'll see how the patients undergoing radiation therapy as oncological treatment has to be cared for. So this is how the patients undergoing radiation therapy have to be prepared. So you have to improve the client's knowledge about the treatment plan and the goals of the treatment. Next, you have to do a proper physical assessment, especially now when the patient is to undergo radiotherapy. You won't know ionizing radiation has got a lot of hazards, so it increases the risk of cancer. And therefore, even though it is a treatment for cancer, when a patient is to undergo radiation therapy, you take all the necessary precautions to aim these ionizing radiation to the exact point, to the place where the cancer cells lie, so as to reduce the chances of damage to the surrounding tissues by this ionizing radiation. So to do that, you have to do a proper physical assessment of the patient, especially in the area where this ionizing radiation is to be aimed at. You have to do a nutritional assessment. You have to make sure the patient does not have any nutritional deficiencies. And also, you have to, not only the patient, you have to educate the family also regarding the condition. And you should educate the patient about the side effects of the treatment procedure. And if there are any practical problems like transportation problems, they have to be, or financial crisis, you should pay attention to those as well. So that is how you prepare the patient for radiation therapy. So radiation therapy has got a lot of side effects. So these are mostly radiation skin reactions, like there will be drying of the skin, pink or red skin, which may be tender to touch, or sometimes the skin will become dry, itchy and flaking. Sometimes it can be blistered and peeling and may peel off. Then there will be tanning, discoloration of the skin. Then in that area where the ionizing radiation is aimed at, there can be a hair loss, right? And in that area, the sweating may be impaired. So there are lots of skin complications following, or skin reactions following radiation therapy. And therefore, it is important to treat the patient, to take care of his skin following the radiation therapy in order to minimize these radiation skin reactions. So these are the things to be done. So when bathing the skin or when cleaning the skin, you should advise the patients to use a mild soap and tap water, and then use a soft cloth to wipe off the skin. Then if there is dry skin, you have to moisturize the skin. So to do that, you can advise the patients to use a non-medicated, non-perfumed moisturizing lotion or a cream. Then before radiation therapy, yes, so before the radiation therapy, you have to Now, all aseptic precautions will have to be taken so as to make sure that the skin reactions will be minimized, and also there won't be any chances of infection. If there is wet desquamation of the skin, you should advise the patients to rinse that area with saline and expose the area to air, and to apply non-adhesive absorbent dressing. And since it's an absorbent dressing, you have to advise the patients to change the dressing whenever they become soaked. And when it comes to clothing, wearing garments, you should advise the patients to avoid tight fitting clothing, especially the clothing that will be too tight over the treatment fields, such as tight brassiers, tight girdles, or belts. And instead of using these tight clothings, you should encourage the patients to use loose clothing, which will not exert too much of pressure on the radiation areas. And when washing the clothes, once again, a mild detergent will have to be used. And you should also advise the patients on how to prevent injuries to the radiation areas. So this can be done by preventing sunburns by wearing appropriate clothing, and you should also advise the patients to be alert on chemical reactions to chemicals such as perfume if it's applied to these radiation areas. Then swimming has to be avoided in this sea bathing, as well as swimming in chlorinated swimming pools should be avoided during the treatment period. And shaving of the treatment field, the area, should be avoided. So that is before and during surgery. So after completion of radiation therapy, you have to inform the clients about, now you have to inform the patients about the side effects. Now I have already told you there can be a lot of radiation skin reactions, so you have to tell the patients that these effects will continue for some time, say for a few weeks after the treatment is over, and therefore and also the area that is exposed to ionizing radiation can become more dry and sensitive compared to skin in the other parts of the body, and therefore you should, if required, the dressings will have to be applied. So you have to advise the patients on how to apply these dressings to help the skin heal, and how they have to use soap when they are cleaning the skin, and what type of clothing they have to use following the treatment. So all these will have to be and how to keep the skin moist. So all these advice should be given to the patient by you as the nurses. So far we have discussed about two treatment procedures for cancer. One is surgery, the other one is radiotherapy. Another important treatment option for cancer patients is biological therapy. So what do you mean by biological therapy? Biological therapy is to administer certain biological agents that help to modify the cancer treatment by modifying the relationship between the host and the tumor. So some of these biological agents include interferons, interleukins, then monoclonal antibodies, hematopoietic growth factors, and colony stimulating factors. So when you administer these drugs in order to improve the patient's response to cancer therapy, that is what you call biological treatment or biological therapy. Next, another treatment option for cancers like leukemia, lymphoma, and multiple myeloma is leukemia and multiple myeloma most of the time is bone marrow transplantation, right? So remember, bone marrow transplantation is another treatment of cancer, especially for cancers like leukemia and multiple myeloma. Next, we'll see nursing of clients undergoing chemotherapy. So, providing nursing care to patients undergoing chemotherapy has many challenges. Why is that? Because the cancer chemotherapeutics are potentially hazardous. So they have got a lot of side effects. So because of that, the patient as well as the family needs to be well educated about the patient's condition and his treatment procedure before starting the patient on cancer chemotherapeutics. And at the same time, you have to take all required precautions to safeguard yourself from the hazards of cancer chemotherapeutics, as well as to make sure that the toxic side effects in the patient will be minimized. So now we'll see administration of chemotherapeutics. So chemotherapeutics are also known as anti-neoplastic drugs or anti-cancer drugs or cytotoxic drugs. So there are several classes. So some are irritants, some are vesicants, some cause extravasation. So these are different classes of anti-cancer drugs or cytotoxic drugs. So you will be now here are some names of anti-cancer drugs which belong to the groups of irritants, vesicants, and non-vesicants. So in pharmacology, you'll be learning about these anti-cancer drugs or cytotoxic drugs in detail. So we are not going to discuss in detail about them here. So we will see how they are administered, the route of administration. So they are administered as an infusion in the veins. So it's a venous infusion. So before cancer chemotherapeutics are administered, there has to be a assessment. So you have to assess the client's physical condition. You have to monitor the patient's baseline vital signs to make sure, and also you have to assess the client's functional ability, his day-to-day living. You have to consider the patient's medical and surgical history, the drugs which he is already on, any treatments which she is currently undergoing, and you have to perform certain investigations like complete blood count, renal function tests, and liver function tests to make sure the patient is fit enough to undergo the surgery and will tolerate the treatment effectively. And if the patient has previously undergone cancer chemotherapy, you have to note down the severity of side effects in previous chemo cycles. You have to check the patient's drug history. Now maybe the patient is suffering from other illnesses and he is on treatment for these illnesses. So in that case, sometimes the drugs which the patient is taking for other illnesses will have interactions with cancer chemotherapy. So to prevent these drug interactions, you have to inquire the patient about the current medications which he is already on, and you have to provide this information to the consultant so as to get his opinion on whether to continue these drugs or whether to switch these drugs to some other medication which will have less interactions with the cancer chemotherapeutics. So this decision has to be taken collectively. So it is your duty to provide this information to the oncological consultant. So after gathering all these data, you have to assess the client to see the potential risks of toxicities. You have to treat the patient as well as the family about the treatment which the patient is to undergo, so as to make them psychologically prepared for the treatment procedure. And then, according to institutional policy, since these cancer chemotherapeutics are potentially hazardous, the drug mixing, administration, and taking care of the patient or the patient follow-up have to be done in a way where all people, that is the health staff as well as the patients, will be minimally affected by the toxic effects of these cancer chemotherapeutics. So sometimes when a patient is to undergo cancer chemotherapy, it will be not only the cancer chemotherapeutic drugs. Sometimes the patients may need supportive medications or pre and post supportive therapies like proper hydration, antiemetics to prevent vomiting and nausea, then diuretics to improve the urine outflow, and electrolyte supplements to overcome certain nutritional deficiencies. So, guidelines for safe handling and disposal of chemotherapeutics. Now, as I have told you before, these cancer chemotherapeutics or anti-cancer drugs or cytotoxic drugs are very hazardous because when they enter into your body, it can easily get absorbed into the system. It can easily get absorbed into your systemic circulation even during contact of the drug or during inhalation of the drug. So that is why the mixing of the drug cannot be done by any nurse. So it has to be done by specially trained personnel. And while mixing the drug, all aseptic precautions will have to be followed. And this mixing cannot be done in any part of the hospital. So they have to be done in specialized areas where which are properly closed, properly ventilated, with facilities for vertical laminar flow hood. And then disposal. So all the substances to be discarded, they have to be removed into, or they have to be discarded into puncture proof, leak proof chemical waste containers. You should not eat, drink, smoke or apply cosmetics when you're inside these mixing areas. And before and after mixing the cancer chemotherapeutic drugs, the working areas all should have to be properly cleansed using 70% alcohol and a disposable towel. And while working, you have to wear all gowns and gloves. Once you're done, they have to be discarded. If there is any spillage of the drugs, you have to act according to the institutional protocol. When you're mixing the drugs, you will have to change gloves every 30 minutes for every client or for any spillage, depending on the institutional protocol, or if your glove is damaged. And every time you change your gloves, the hands should be properly washed. So here are some principles. Now you can see cancer chemotherapeutics have a lot of side effects. So therefore, there are principles in applying cancer chemotherapeutics to oncological patients. So these are the this is an easy way to understand these principles. So it has to be right client, right drug, right dose, right route of administration, right time of administration and the frequency of administration, right documentation, right history and assessment, right to refuse, right drug to drug reaction and evaluation, and right education and information. So all these show that cancer chemotherapeutics are potentially hazardous, and therefore you have to follow strictly, you have to adhere to the institutional protocols and to the guidelines when handling these cancer chemotherapeutics. Now we'll see how the chemotherapy adverse effects have to be managed. So if any adverse effects appear, any life-threatening adverse effects appear, you will have to stop administering the chemotherapeutic agent. You have to notify the doctor. Leave the cannula in place because they are given IV. So you leave the cannula in place. You should not try to remove the cannula, but you have to aspirate and discard any residual drug that lies in the blood or in the intravenous tubing or in the needle and in suspected infiltration sites. Should never apply pressure in the infiltration sites, and if required a topical ointment can be used, and you have to cover the area lightly with a sterile dressing, and if ordered by the doctor you can apply cold or warm compression, but that is depending on the consultant's opinion. You have to do proper documentation, which includes date and time, physician notified, drug administered, approximate amount of drug extravasated, nursing management of extravasation, condition of the client, appearance of the site, and follow-up measures. So this is how a patient on cancer chemotherapy have to be monitored. You have to monitor the patient for vital signs and the insertion site for infiltration, for extravasation and infiltration, and you have to monitor for extravasations. And sometimes some patients may develop chemotherapy induced hypersensitivity. So in that case you have to observe the patients for chemotherapy induced hypersensitivity. Next, you have to do certain investigations like blood counts to see whether they are as per the recommendations, as per the levels recommended for cancer chemotherapeutic patients. So this is how these are the things which you do to monitor patients undergoing cancer chemotherapy. So that comes to an end in today's session. Thank you very much for listening.